Hi, I'm Michael Sayre and I'm the Medical Director for the Seattle Fire Department. Thanks for being here today. Let's cover two quick topics. You may be aware that we have invited a small group of paramedics and EMTs to learn how to administer buprenorphine or Suboxone to people who are in acute opioid withdrawal after they get Narcan. Now, during this module, you're getting refresher training on how to administer intramuscular Narcan. But some people get too much Narcan. Maybe they got it from their friends via nasal spray and got 1, 2, 3 nasal sprays. Maybe you weren't sure and you gave them Narcan and they already had a nasal spray and now they have too much Narcan and they're in acute withdrawal. What we're hoping to learn is, can we entice some of those patients to let an EMT working with Health One or one of these paramedics who are in the pilot program give the patient a dose of buprenorphine. And what that will do is reduce their withdrawal symptoms so they won't feel so terrible. And then they're willing to go to the emergency room and get a prescription for more buprenorphine, which could be a real win in terms of preventing them from having further overdoses and you guys having to go out, and potentially putting them on a road to recovery. So I just want to make sure you know that's coming, and we're starting that this month. I'm sure we're going to learn a lot, but a key to this puzzle is trying our best not to give patients too much Narcan, just the amount that they need and not too much. The second thing that we've started to do, and I want to really give you my thanks for this, is the FACT study. So we're in the startup phase of the FACT study, in which we are doing bag mask ventilation and a compression rate of 120. Now, some people have asked a really good question, which is, how can you really answer two science questions in the same study? Isn't that going to interfere with finding out the truth? And the way we look at this is to ask ourselves, well, if we're going to do two different things, let me start that over. If we're going to ask ourselves, like, we're going to go to all the work to answer one science question, could we get a 2-for-1 deal? Could we answer two questions with basically the same amount of effort? And in this case, we don't think there's going to be an interaction between how we deliver oxygen, whether we're using bags or an eye gel, and the chest compression rate, but it's possible. So in essence, we end up with 6 groups of patients. So we have the people who got bag mask ventilation from you guys, and then they got a heart rate of 120, 110, or 100. And then we're going to have a group of patients who get eye gel from you guys, and they're going to get a heart rate of 120, 110, or 100. So we'll have 6 groups of patients. And at the end of the study, the statisticians will look at this and ask, is there an interaction? And for example, it's possible maybe people who got a heart rate of 120 do better if they get ventilation with a bag mask, whereas people who get a compression rate of 100 do better if they get ventilation with an eye gel. I don't think it's very likely, but it's possible. And the statisticians will tell us if that interaction exists. Most likely there won't be, in which case we'll succeed in getting our 2-for-1 deal, and we'll answer 2 science questions with 1 study effort. So thanks again for your doing the FACT study, and you're doing a great job, and thank you.